Watche, and welcome. This is Anne from the Sublocade Practice Consultant team, and you're listening to the Practice.Support podcast, the one and only show that discusses new practice updates and changes for ISC's Ontario region. Coming to you with acknowledgement to the Anishinaabe Algonquin Nation, whose traditional and unceded territory this podcast is recorded on, and with respect to the different traditional Indigenous territories of Turtle Island that this podcast may find you. Hello everyone, welcome to today's episode with Sibo Kumalo. She's been a Northern nurse since 2009, a nurse practitioner since 2014, and she recently joined the education team this year. Welcome to today's episode, Sibo.
Thank you for having me.
So, what are we speaking about today?
Today we are speaking about Sublocade. Sublocade is a medication used to treat moderate to severe opioid use disorder for patients over the age of 18.
Okay. So why did we want to discuss Sublocade today? Has this become important for Northern nurses to be aware of recently?
Yes, definitely. So Canada is facing an opioid crisis. Opioid use disorder has been on the rise in northern communities as well. We are seeing more and more patients being prescribed Sublocade in some northern communities to try and curb this epidemic that the country is facing.
That's a really good point, Sibo. Could you tell our listeners a little bit more about Sublocade?
So Sublocade is an injection that is delivered continuously at a sustained level throughout the month. It has been shown to reduce the incidences of relapse and has a higher adherence rate compared to the oral Suboxone. Sublocade improves the quality of life of patients. It removes the stigma of the daily observed therapy, daily reminders of the disease, and reduces the risk of misuse and abuse.
This sounds really great. How would you go about starting a patient on the Sublocade?
Well, patients first undergo an induction and stabilization process by a prescriber. Stabilization can take 7 days. They are started on the Suboxone. After the induction, patients are usually transitioned to Sublocade at 300 milligrams a month for 2 months, followed by maintenance doses of 100 milligrams a month. It's injected every 28 days, no sooner than 26 days, and it can be given as late as 45 days.
The Sublocade is administered just by injection? What type?
It is injected subcutaneously in the abdomen. Once it's injected, it turns into a solid gel, which is called a depot. The depot gradually releases the buprenorphine at a controlled rate all month. The levels of the buprenorphine in the blood stay consistent throughout the month.
So, since this is an injection, can this also be administered intramuscularly?
Unfortunately not. You do not administer Sublocade intramuscularly or intravenously. It has to be subcutaneously, otherwise it will cause serious harm or death.
Okay, that's a really good point to note. This seems to be long-acting, so what if the patient decides they want to discontinue the Sublocade?
That's not a problem. The patient is put back on the Suboxone tablet. The patient is resumed at the previous oral dose of Suboxone between days 28 and 30 after administering the injection. Patients should be monitored for several months, though, for signs and symptoms of withdrawal.
Can any registered nurse administer the Sublocade?
Yes, any nurse can administer the Sublocade. They just need to be certified first. There is a learning module on One Health with instructions of how to be certified.
So after they are certified, what sort of contraindications should the nurses be aware of when using the Sublocade?
The most important one is they should be aware of any concurrent use or abuse of any CNS depressants like benzos, alcohol, and other sedatives. This increases the risk of respiratory depression. They should be aware of any patients with moderate to severe liver impairment or respiratory insufficiency. Women of childbearing age should be on an effective birth control unless the benefits outweigh the risks. Prenatal patients should be switched back to Suboxone because there is limited evidence on safety during pregnancy. There are a number of other contraindications, and they are all listed on the Sublocade monograph.
Oh, that's excellent, Sibo. So there's the resources that are on One Health. Are there any other websites that they can get some more information on, Sublocade?
Yes, there is a very good website. It's www.sublocade.com. It has all the information related to Sublocade.
Excellent. So that's sublocade.com, sublocade.com. So thank you very much for being on our episode today, Sibo. I really enjoyed the review of Sublocade.
Thank you for having me. It was great sharing this information with you.
Thank you all for listening to the Practice Support Podcast. If you're keen to follow up on any of the information you've heard today, head on over to One Health and iTacit, where you'll find more links and resources. For more practice updates, don't forget to find and follow us on our Instagram, Facebook, and YouTube channel at SLKT.Nursing.Practice.Support. And as always, if you have any questions, please reach out to a nurse practice consultant, an education practice advisor, or your manager. That's all for this episode, folks. See you at our next podcast.